Welcome, everyone. Thank you for joining us this afternoon. This is the Hemophilia Council of California's Advocacy and Public Policy webinar, Choose Smart, Don't Be Overwhelmed by Your Healthcare Choices. I would like to introduce our speaker for today. We are really thankful to have Kassy Perry from Perry Communications join us today. Kassy is a former broadcast journalist who has also served as a communications advisor to 3 California governors and a state legislator, and been principal consultant to a legislative policy committee before opening Perry Communications. And Perry Communications works very closely with the California Chronic Care Coalition, among others, which is one of our partner organizations that works a lot on patients' rights and access to care. So we're pleased to have Kassy here today to help us walk through these complicated issues of insurance. So thank you for joining us.
Thank you for having me. And since we're still living in this weird COVID world, if you hear dogs barking behind me, I apologize. They're locked out, but one of them's really large, so you still hear them. So thank you very much, Lynn, for including me in this important conversation. One of the things that I've done along with that kind of interesting past of being a journalist and working for some electeds is several years ago, a colleague of mine, Liz Helms, who's the president of the Chronic Care Coalition of California, and I got together and said, you know, we're fighting all these kind of insurance battles. We really need to educate consumers. We need to work with the policymakers and the regulators and help people choose the right plan, because health insurance is much more complicated, unfortunately, than buying car insurance and homeowners insurance. So several years ago, my team and I created MyPatient Rights, which is a program of the California Chronic Care Coalition. And working with the California Department of Managed Healthcare, we put together kind of a program to really help consumers choose the right health plan initially, and then on the other side, help walk them through a fairly complicated process to, complain about not getting the care you need. So today, I'm going to walk everyone a little bit through how to choose a health plan based upon your own needs. Many of us, have to wait, if we have private insurance, have to wait until open enrollment to make choices. Because of COVID, that's all very kind of up in the air, and an open enrollment, I think, for Covered California is continuing. For Medi-Cal, coverage is ongoing. And Medicare obviously depends on your birth date and when you're eligible. So today we're going to really focus on how to choose a health plan. And forgive me for those of you that this might be remedial, but it's a good reminder. And when I was prepping for this discussion today, I had an aha moment of my own with when a family member kind of getting crosswise and trying to get a medicine. So it's a good, kind of primer for everybody to remember that as a patient, you have rights, and we're going to talk about those. But you also have a kind of a responsibility to look at your own needs and those of your family members if you have dependents, and choose the right health plan for you and your family. So I'm going to go through, next slide, Lynn. I'm going to go through a little bit of the kind of how to and kind of the lexicon or dictionary, so to speak, because it really stumps people sometimes when they don't understand if they have health insurance. Why do they walk to the pharmacy counter and have to pay $500? So just making sure we're in a level set. These are the terms insurers use for all Medicare, private insurance, employer-based insurance, and for Medi-Cal. Your copayment. Your copayment is the fee you pay every time you go to the doctor or to fill a prescription. And those range depending on what insurance plan you pick. But it's something important because that comes out of pocket. And when people complain about the cost of healthcare, they're typically complaining about their out-of-pocket cost, because that's what they feel. They don't really feel the fact that if they went to the hospital and had an MRI and the insurance company covered that and went back and forth, it didn't come necessarily out of their own pocket. So we really focus on kind of, as we're choosing our health plans, what comes out of our own pocket. The premium, that's the monthly bill that you pay to your health insurance company. If you have employer coverage, that's split usually between the employee and the employer, if you're lucky. Deductible. And this is really interesting because deductibles have been increasing dramatically over the last 12 years. Deductibles used to be just in high risk insurance, high deductible health plans, that super healthy people would pick because they didn't think they'd ever go in there and they'd have a high deductible. And it was something that Congress was really pushing years ago to try and fill the gap of those that are uninsured. A high deductible plan can be problematic because your co-payments and things that you pay up front might be lower, but you're going to pay, every dollar of the first $5,000 of your coverage until it kicks in. So that's something that people really need to look at. Your out-of-pocket maximum, and that's shifted dramatically over the last couple of years. What is your out-of-pocket maximum? And that's the most you're going to have to pay before your insurance kicks in full time. Anybody who has Medicare knows about the donut hole, and that's the same kind of concept. Like, how much do I have to kick in before my insurance covers everything else? Prior authorization. And this is an important term, and it's changing dramatically. And those of you who are buying factor or involved in loved ones that use specialty medicines, the games that are going on between the pharmaceutical manufacturers and the pharmacy benefit managers who buy from them, and then the health insurance companies who buy from them, it's very hard to track sometimes what is prior authorized and what's not. So making sure that when you're choosing your health plan, if your factor is covered or if your medicines are covered. And you now, because of some of the work that the Chronic Care Coalition and the Hemophilia Council has done over the last decade or two, we really run quite a bit of regulatory change so that you can find out what's covered ahead of time, because that's incredibly important for people that rely on these specialty medicines. Coinsurance is a term that we are just starting to see all the time now. It used to be fairly rare. Coinsurance is the cost sharing when you pay a set percentage of the covered service, and then your insurance company covers another part. With expensive specialty meds, we see patients that are getting hit with the high deductible and a coinsurance for the medicine. So they're paying, a large fee up front, to get their medicines. And so a lot of what we hear about, like the high cost of drugs and things, is again, because the health insurance is cost shifting more of these to the patient. And so choosing that health plan up front is becoming even more important than it used to be. And then a copay accumulator, which is a lovely term. So, health insurance companies came up with in PBMs a program, a copay accumulator, or also called accumulator adjustment program. It's a strategy that's used by the PBMs and insurers that stop the manufacturer copay assistance coupons from counting towards the deductible or the maximum out-of-pocket spending. We know that the pharmaceutical manufacturers have worked and created patient assistance programs for those who cannot afford their medicines. And so these copay accumulator programs have popped up in the last couple of years as a way to, again, cost shift to the patient. And so the help that they get from the pharmaceutical company doesn't help them as they pay for their medicines. So with that all said, and it sounds all depressing, I'm sorry, but that terminology I think is important for people to work through that. And then again, there's step therapy as well, which means that we like to sometimes call it fail first, which means you might have to fail on a less expensive medicine before you get the medicine you need. So step therapy is encouraged as well. All of these are ways that insurance companies are trying to keep premiums down and say that they're more affordable, but you need to be a really educated consumer to be able to make the system work and to choose the right plan when you choose a plan. So through MyPatient Rights, we created kind of a checklist on the Choose Smart campaign. And on the screen, you can see kind of the checklist. And it really requires you to do a little introspective investigation about yourself and your loved ones who are on your plan. How often do you see the doctor? Are you fairly healthy? Do you need just catastrophic care in case of a car accident or something? Or do you have chronic conditions that need to be managed? Those all different things, those questions and stuff will really dictate which kind of plan that you're going to need going forward. Because nobody wants someone choosing, and we've seen it often, a high deductible, inexpensive bronze plan on Covered California, And then they're hit with all these extra costs that they didn't think they were going to have. So the checklist, and you know, at the end of this conversation, I can direct you to the website where it is, but it really helps everyone go through kind of, when I have an opportunity to choose a plan, which plan should I choose based upon my needs? And again, since this is the Hemophilia Council, I'm assuming that either you or your loved ones need blood products and things and expensive care. So making sure that the health plan will cover that in a way that's affordable is important.
We thank Kassy again for joining us for this great information. We will put the links on our website along with the video when we have it completed. And we really appreciate everyone joining us today. Thanks so much. Well, we will see you next month.
Thank you, Lynn.
Thanks. Bye-bye.